While it is the common belief that the COVID-19 disease affects children in the mildest form, a new research has found that a possible consequence of a child contracting COVID-19 is now a disease called multi-system inflammatory syndrome. Although this condition has not been detected in Guyana, the Ministry of Health remains on high alert.
So MISC, we have not really seen any case here as yet, but it's a very rare condition, but it's something that we have to constantly look out for.
According to the Centers for Disease Control and Prevention, multisystem inflammatory syndrome, or MISC, is a condition where different body parts can become inflamed, including the heart, lungs, kidneys, brain, skin, or eyes. While the true cause of the condition is still being debated, medical professionals have found that many children with MISC had COVID-19 or had been around someone with COVID-19. MISC can be serious, even deadly, but most children who are diagnosed with this condition have gotten better with medical care. As such, while the ministry has not discovered any case of MISC, it is important for parents to look out for the signs and symptoms associated with the condition.
Is to see whether or not there's a rash. So if the child has a rash, bilateral rash, meaning on both sides of the body. Another thing that you look for is conjunctivitis, and that is like pink eye. So that's something too that you would pay attention to. Hypotension, meaning that there's a drop in the pressure.
Other signs include cardiac dysfunction, bacterial infection, and a positive COVID-19 test. Interestingly, 5,594 children have tested positive for COVID-19 locally since the first case was detected in March 2020.
Within this age group, we are seeing persons or children testing positive, because I think for some people it's a myth that children are not going to be positive and things like that. That's far from the truth, because we have this 5,594 children who've already tested and confirmed to be positive.
On another note, there has been a marked decrease in the number of adolescents who are coming forward to access the Pfizer vaccines.
For the children, we have initially saw rapid uptake of the vaccines, and these are the Pfizer vaccines. However, I think over the last week we have started to see a slow off, where not as many children are coming forward to get vaccinated. We need this to go up back again.
At present, 26,882 adolescents have received the first dose of the Pfizer vaccine, while 17,357 adolescents have received both shots. More so, 377,614 adults, or 73.6% of the adult population, have received the first dose of a COVID-19 vaccine, while 237,997 adults, or 46.4% of the adult population, have received both doses. He reminded that a number of persons are still to be vaccinated with the first dose, while citing that Region 4 is the only region where over 80% of the population have received a first dose. The minister reiterated his calls to persons to come forward and get vaccinated, while warning that it is not the time for Guyanese to be complacent, but smarter. For the HGP 90 News, Kendell Richmond.